So the inner part or anterior superior part of the tympanic membrane or eardrum is having the chorda tympani, which is bringing the taste sensation from the anterior two-third of the tongue of the same side, and also having preganglionic parasympathetic fibers for the submandibular and the sublingual salivary glands, which will relay in the submandibular ganglion. The submandibular ganglion is one of 4 parasympathetic ganglia in the head and neck. Others are ciliary ganglion, otic ganglion and pterygopalatine ganglion. The nerve supply of this tympanic membrane is coming from the 3 sources. The outer part or lateral surface is having anterior-inferior part, which is innervated by the auriculotemporal nerve, again branch of mandibular nerve, and the posterior superior part is innervated by the vagus nerve and fibers of the facial nerve, as we have seen in the external acoustic meatus, the posterior wall and part of floor. The medial surface or the inner surface of the tympanic membrane is innervated by the glossopharyngeal nerve, which is forming the tympanic plexus in the middle ear cavity. Now I will move on the middle ear. Little complicated but not very difficult to understand. The cubical structure, the middle ear is cubical, it is cube-like structure. So, cube-like. It is having 6 walls. And it is one of the 3 parts of the ear, the external ear, the middle ear and the internal ear. So simply it is connecting the external ear to the inner ear, and it is also transforming the vibrations of the sound waves which are produced in the air into the vibrations in the fluid or in the liquid in the inner ear. So part of the ear between the external acoustic meatus and the inner ear is the middle ear, also known as tympanum. So it is also known as the tympanum. Or the tympanic cavity. This is air filled cavity, it is not having any fluid or liquid. So this is simply air filled cavity having 6 walls and cubical structure having anterior posterior and vertical diameter almost same, 15 millimeters. So when we talk about this cube, this is a cube which is having 6 walls, the anterior, the superior, the inferior, posterior and 2 lateral walls. So it is having 6 domains. One is the upper domain. This eraser, it is having 6 walls. So the cavity of the middle ear is like a cube having superior wall or the roof, the inferior wall or the floor. So we can see here clearly the superior wall or the roof, the inferior wall or floor. If I consider this wall as the lateral, so this is the medial wall, the anterior wall and the posterior wall. But when we see the coronal section of this cube or middle ear cavity, it looks like this. It is not equal in its all parts from above downwards. So when we take this section, the coronal section, the diameter of the uppermost part is the highest diameter. The breadth is 6 millimeter and lowermost part is having 4 millimeter. So it looks like this. And the middle part is only 2 millimeter. So simply it looks like a figure of a beautiful girl. Uppermost part is having 6 millimeters. The width of the middle part is only 2 millimeters and the width of lowermost part is 4 millimeters. So it looks like figure of a beautiful girl. The uppermost part of the tympanic cavity, as we have seen, the tympanic membrane is convex from its medial and concave in its lateral part. So again, this is the tympanic membrane. This part, which is lying opposite the tympanic membrane, this part is known as tympanic cavity. So tympanic cavity is used for this cavity proper. This word is used for this cavity proper, and from here to here, this is known as tympanum or the middle ear cavity. The part of the middle ear above the tympanic membrane is known as epitympanum or epitympanic recess. This part is known as epitympanum. Or tympanic, epitympanic recess. Sometimes the part of the cavity, very small part of the cavity, the lowermost part is known as hypotympanum and this part is known as tympanum. So this is the tympanum and this part is the hypotympanum. So simply the cavity, when we see this section, the coronal section from here, the cavity, this is the roof, floor, the lateral walls, the anterior and the posterior walls. Now I will talk about the walls of this cavity one by one in detail. But before moving on the detail of the walls, I will discuss about the contents of this tympanic cavity or the middle ear cavity. It is having three small bones known as ear ossicles. It is having three ear ossicles named as malleus, incus and stapes. And third is the stapes. These are named according their shape. So this is hammer like, this is anvil shaped, and this is stirrup shaped. So we can use mnemonic MIS HAS has to remember the name of the ossicles and the shapes of the ossicles. It is having two muscles. One is tensor tympani and other is the stapedius. So it is having two muscles, the tensor tympani and the stapedius. Two nerves, although it is related to three nerves, but it is having nerve supply or innervation from two nerves. The tympanic branch of the glossopharyngeal, the tympanic branch also known as carotico-tympanic branches, superior and inferior, from the sympathetic plexus through the carotid artery. Carotico-tympanic branches. This is the somatic afferent, bringing the sense of pain, touch, temperature from the middle ear, and this is related to postganglionic sympathetic for the mucosa, vasomotor for the mucosa of the middle ear. And third nerve, the chorda tympani. This is a branch of the facial nerve, the nervus intermedius, and bringing the sense of taste from anterior two-thirds of the tongue, and also having preganglionic parasympathetic fibers for the submandibular and sublingual glands. So it is having three ossicles, two muscles, the tensor tympani and stapedius, and three nerves, the tympanic branch of the glossopharyngeal nerve, the carotico-tympanic branches of the nerve plexus around the internal carotid artery, and also the chorda tympani. So first of all, I will